Isn't that what retirement is? Twenty-seventh, please join me for the Pledge of Allegiance. I pledge allegiance to the flag
of the United States
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice. Thank you. Roll call, Shelley.
Honorable Mayor Grover,
I'm present.
Councilmember Overhauser,
Present.
Councilmember Schmidt,
Present.
Councilmember Bartels,
Present.
Councilmember Bealock,
Present.
Councilmember Labar.
Present.
And we do have excused absences for Councilmember Postuma and Councilmember Nazaro.
Correct.
Thank you. On the agenda, the next step is citizen comments. This is an opportunity for the public to provide comments to our city council. I did not get anybody signed up, nor did I get any emails, but I do want to offer it up to the crowd right now if you wish to provide comment to council. How about anybody that's joining us via Zoom? Going once, going twice. Okay, let's move on. You've had an opportunity to review the May 13th regular city council meeting minutes. If there's no corrections to that, accept the motion to approve them.
So moved.
Second.
Thank you. I have a motion and a second to approve our minutes from our May 13th city council meeting. All in favor, say aye.
Aye.
Opposed? Thank you. Our minutes are approved. Vouchers, Cindy.
$16,912.57. There are some annual other payables for $80,300.68 for a total of $797,213.25.
Thank you, Cindy.
Your Honor, the Finance Committee reviewed these items. I would move approval.
Second.
Thank you. I have a motion and a second to approve the vouchers as presented. Kind of a light month. All in favor, say aye.
Aye.
Opposed, nay. Thank you, Cindy. Our vouchers are approved. Yes.
Wanted to interrupt you briefly
Yes,
to
please.
move
Sorry.
that we add an agenda item.
Yes, please.
An executive session.
Okay.
Second.
A motion and a second to add an executive session at the end of our action items this evening. All in favor, say aye.
Aye.
Opposed, nay. Thank you, Councilmember Overhauser. We're going to add that executive session. You can see we didn't have any claims for damages, but there are a couple small contracts, one for water walking, Chris Babcock. This is the rec contracts, Inland Empire Diving, Learn to Dive Camp for this summer.
Jesus would be leading that one.
We do have, it's not listed, but I do have an informational item, and I'd like to ask Chief Jenkins to come on up to give us a little update on the AMR contract. Thank you.
I'll try to keep this within 10 minutes or so as a
Oh,
quick
I have to-
presentation. Is it working, Cindy?
Yeah, but just hold on.
Oh, okay, so while Cindy's figuring that out, I'll go ahead and introduce Tim Lonkin here. So Tim just informed me 43rd year with fire and EMS transport services. Tim currently works for AMR. But before Tim started working for AMR about 2 years ago, he was on this side of the fence in the fire service. Worked several years for the City of Spokane Fire Department as their EMS officer. And then for about the last 2 years, before he retired, I think the third time, was working for Spokane County Fire District 3 to stand up their EMS service as well, with having paramedics coming on board. He thought the grass was greener by retiring and headed down to Las Vegas. Realized that wasn't a good retirement move, so he came back up to Spokane, so.
Keep talking.
So, with that, it's probably no surprise to some of you that, I've been the chairman of the ambulance service board for the county now for 5 years. And I've had a lot of good debates with our private contractor AMR and the services. And so I think with that, the regional director for AMR here, at least within this region, realized that he was quickly losing the fire chiefs in Spokane County. We were becoming fed up and pretty upset with how the contract was going. So the first great move that regional director did was to hire Tim Lonkin as sort of the liaison between the fire chiefs in the county and AMR's behalf. So
Okay.
Tim, was there anything you want to say?
No, I just appreciate the opportunity. Take us to invite us here. Hopefully we can answer some questions if need.
It's gone. If you can help share that.
Is it up already?
There we go.
There it is.
There it is.
Yeah, brilliant. Sorry.
Is that as big as it goes?
My wizardry.
We do full screen and then slideshow.
Sad.
You're up there.
I'm
Uh,
not usually sitting here. I'm doing the best. Hold on.
Sorry, there's two.
Screen. There we go.
Perfect. Thank you, Cindy. And can I turn that into a,
Now, now you can do it.
I can only do it on my screen. There you go.
Got it.
I got it. I think. So I apologize. A little bit of the history there with the interlocal cooperative agreement established in May of 2008 amongst the majority of the fire departments in Spokane County, with the exception of the City of Spokane Fire Department. That's where this gentleman over here established a separate contract with AMR. As I mentioned, the contract administrator, which I have threaded throughout here, is just the agency that took on the responsibility to manage the contract. because there's a lot of things within the contract that has to be managed on a weekly, monthly, quarterly, annual basis. Right now, that's Spokane County Fire District 9. I'll highlight that here in just a second on the map. And then the core focus of our previous contracts in Spokane has been solely rate-based with a time response. And I'll pivot from that halfway through to explain why we're going away from the rate-based game. But this is just, should be one click. There we go. So who does the ambulance service board comprise? Fire districts 5, 10, 3, 12, 2, 11, 9, 8, and 13 in the city of Airway Heights and the city of Cheney. And I'll draw your attention to the far north end of that map where Fire District 4 about 3 years ago, 2.5, because they were not being well represented in the northern tier with Deer Park Ambulance. They decided to pull out of the consortium. Took about 1.5 years for them to get their own transport license from the state of Department of Health. And since then, they were able to secure a separate contract with AMR to serve their northern tier of Spokane County. So Spokane Fire District 1, which is otherwise known as the Valley Fire Department, they were the contract administrator since the inception back in 2008. Last year, Spokane Valley Fire Department decided to withdraw from the consortium as a whole, and they started their own contract with AMR as well. Any questions with the member agencies? As I mentioned, District 9 stepped up to take over the contract as a contract administrator because none of us had the bandwidth or the personnel to oversee the contract, to manage it on the day-to-day. So the first thing we did on the ambulance service board side is we hired a consultant, a gentleman by the name of Mike Lopez, who spent many years with Tim Lonkin, worked for State Department of Health for many years, retired from City of Spokane Fire Department as well. Is a wealth of knowledge. So he wrangled all us fire chiefs within the consortium. We came up with what we agreed to be a mutually in-state goal to make sure we're assuring transparent accountability, innovative strategies, and quality service to the citizens that we serve. For a variety of different mission sets there. And I did print this off and put it in front of you for you to read it as well. So in addition to that, Mr. Lopez, our consultant, sent out a survey to the fire chiefs that was part of the consortium with the ambulance service. Comprised of a lot of great questions. You can see the core focus areas there. I know that looks really small on the screen here, but what it did was it highlighted basically what our thread or common concerns were, the commonalities amongst the fire districts as it related to having a private contractor serve the county for ambulance transports. And then there were some low line areas too that we knew we didn't need to focus in. If that wasn't a focus of the fire chiefs in the consortium, then why do we need to spend a ton of time and energy in that? And I'll digest that a little bit better in this next slide. So what did that really come out to be? Well, we as a chiefs desire to have a high degree of collaborative approach and a partnership with our contractor. I think it was a great first step forward that AMR Corporate allowed someone like Tim to come on board, made a position for him just as a liaison between us fire chiefs and AMR to vet some of the concerns and frustrations that we have been having for quite some time with AMR. We also wanted to focus in on the depth of resources. Let's face it, Spokane County is growing. It's growing. Arguably, we've lost hospital capacity over the last couple of decades in Spokane County. And it's becoming more difficult for us as a whole collective, not just on the fire side, but as our ground ambulance transporter side as well, of getting patients to the hospitals to get the care that they need. The quality and number of the resources, we'll talk about some of the training that we have collaboratively agreed to within the contract, and then the inability to subsidize ambulance service enhancements. So that was one of the questions that Mike Lopez asked us fire chiefs, is that if you're not happy with what you have and you desire to go where you want to be, are you willing to subsidize any of that? Well, that was the number one on the previous chart. None of us were willing to actually subsidize because we're all operating on a pretty thin margin to begin with. So what did that mean? That means AMR then has to collect revenue solely from patients, from the citizens. Every time they transport a patient, they get a bill and hopefully they're made whole. I'll talk about a little more of that right here. You can see our strategic focus, having a system that was sustainable to keep up with the volume and demand here in Spokane County. Really the volume and demand that we're seeing across the nation as a whole. What does it really mean to bill your patients, and what does the payer mix look like in Spokane County? What is the Balanced Bill Act, and how did that greatly impact our private contractors who do transport services? How can we potentially look at tapping into the Ground Emergency Management Transportation Program of federal grant funding and come up with some creative solutions that will endure? So really, this slide just shows you that about 77.2% of the payer mix in Spokane County is Medicare and Medicaid. So the patients that we respond to and the patients that end up getting transported by a private contractor to go to the hospital, 77.2% of that is through Medicare and Medicaid, a very fixed small amount. What that meant is that the private contractors like AMR had to seek the reimbursement through the patients. And generally for Medicare and Medicaid, it wasn't that much of a revenue for them to get back in return. With 11% making up basically your private pay, and then it's broken down a little further. So our consultant reached out to several agencies across Washington state as a whole. They came out with a median rate of about $1,200 a transport. That's right about where Spokane County's Ambulance Service Board contract was about a year and a half ago. It was right about $1,240 is what AMR was charging. So we were right on par with the average. Where they needed to be at the time of negotiating this contract over about 8 months was somewhere in the neighborhood of $2,300. I know that's a sticker shock. They're looking at $4,000 in certain areas across the state of Washington. None of this really matters, and I'll explain why. So once again, on the billing rates here, focus back on that 77.22%. Medicare and Medicaid. You can see how little Medicare and Medicaid pay out from the federal government. It's a very, very small amount that the federal government, those are numbers that our federal government hasn't changed in decades. It's been a long time coming. And then your commercially insured, which make up that 4.7%, they pay out the best, but that's only 5% of the total people that we transport. Not a lot of revenue or not a lot of meat left on the bone for private contractors to transport. So the Balanced Bill Act, which started in January of this year, basically added a ground transport ambulance services. What does that mean? That means that every time someone calls 911 and every time an ambulance shows up and every time they transport you to the hospital, that's an unexpected bill. And the citizen should not have to pay an unexpected bill. So Washington state has now banned private contractors like AMR to seek the differential from the citizens. So chasing rates, us chiefs managing rates across the board in Spokane County becomes a moot point. The contractor is going to get whatever the insurance carriers pay, and they can't go after reimbursement from the citizens. Am I saying that correctly, Tim? Okay, correct me if I'm wrong, buddy. And then in addition to that, the Office of Insurance Commission has mandated, because of the Balanced Bill Act, which incorporated the ground ambulance services, they have established a public-facing website that by October of every year, every one of us fire departments have to go in. I've got to reach over unilaterally to AMR and say, hey, what are you currently charging? And then we've got to post that up so it's more transparent across the board as a state as a whole. So I really like that move from the Office of the Insurance Commission. But once again, AMR could charge you $5 million for that ambulance ride, but they're only going to seek revenue with whatever the insurance carriers are going to pay out. A little drastic there, sorry, not quite fine. So as I said before, the new contract, we're not going to be focused on a rate anymore. So these are some of the highlighted changes that we incorporated into this new 3-year contract. Incorporating an ambulance service board liaison. Create policy and quality improvement committee. I'll break each one of these down in the next 6 slides. Enhance EMS preceptorship program, training program for our EMS providers. Reimbursement for disposable medical supplies. Having a tiered ambulance response model. Paying liquidated damages if firefighters ride in with the ambulances. And access to the ambulance provider's purchasing power. So what is the liaison? The liaison is a third-party person that we are going to put on retainer with the Ambulance Service Board. And just so you know, and I didn't add it to these slides, but the contractor pays the contract administrator, Spokane County Fire District 9, money to oversee the contract. And that's what these monies will be used for. So that's not money coming out of the City of Cheney Fire Department's coffer. It's coming basically from the contractor to manage the contract. So AMR is paying for this. But we'll have an independent liaison that will be a focal point between the Ambulance Service Board and AMR to address any concerns on an ongoing basis. Skip one. The Policy and Quality Improvement Committee, just like you all for City Council, you know, because we are formed under RCW, we're also an Open Public Meeting Act. Sometimes it's very difficult when you get the chiefs and AMR in a room along with members of the public to have honest, open, raw conversations. So therefore, we devised a Policy and Quality Improvement Committee comprised of 2 people from the Ambulance Service Board, 2 people from AMR to get together on a more frequent basis to hammer out any issues or concerns. And to also maybe try to highlight any trends or anything that would be good for system enhancement moving into the future. Matt, Tim? The EMS preceptorship is basically just a good training platform. You know, AMR spares no expense training their folks from paramedics all the way down to EMT basics. And we would be foolish on the fire side not to tap into some of that experience and some of the programs that they have. AMR's parent company, Global Medical Response, is just that. They're a global company. So they've agreed that, you know, through collaborative efforts that we're going to start doing a little more training with them, and we're going to have access to some of their great programs under the preceptorship program. This is something that may be of interest to you, disposable medical supplies. So this is something that has started being offered up in other contracts across the region. We wanted to make sure that it did pass the anti-kickback sniff test. The attorneys did review that, but basically what that means is that every single time AMR shows up and transports one of our citizens, then AMR will basically pay us a negotiated rate. Spokane Valley Fire was the first to go to this. We're not sure exactly where that dollar is going to lie, probably somewhere between $8 to $12 a transport. And that's just to reimburse the fire department for those medical supplies that we use on an ongoing basis. So those monies will be kicked over to the contract administrator, who in turn will disseminate the funds based on how many transport we have per jurisdiction per fire department. So that'll be a little bit of funds coming back in to help ease the blow of how much our medical supplies are starting to cost. I'm all over the place here. A tiered ambulance response model might be the one that's the singular thing in the contract that's the most tumultuous, and it's probably going to be a more of a steeper learning curve from our firefighters than from AMR. You know, with the military, I've lived in 6 states across the United States. This is the first one where it's just all ALS. You call 911 and a paramedic showing up. Well, that's nice. But what that also means is 60 to 70% of the time our patients are not ALS patients, are not that critical. So why are we sending a paramedic to pick up one of our citizens? It's going to cost them more money in the long run, because then AMR gets to seek reimbursement at an ALS rate than if we were to right size and send the correct level of care to the correct patient. Not to mention that, yeah, there's a national shortage with people wanting to get their paramedic. We're seeing it across the state as a whole. Here locally in Spokane, we've seen a lot of firefighters lose their paramedic license. A lot of legalities and a lot of concerns with that. So the writing's on the wall. We need to bring in more ambulances into Spokane County. AMR can't afford to put a paramedic on every single ambulance. So how we transition that is to incorporate BLS ambulances throughout the county for those basic life calls, basic life support calls, the low acuity calls that should average about 60 to 70% of our total emergencies that we get. Any questions with that? Liquidated damages. So we wanted to build in some assurities from the fire department side with AMR to say, okay, if you're going to flood the streets with BLS ambulances, don't show up to Cheney and expect for a paramedic to ride in every single time, because that's not going to happen. We don't have enough paramedics to go around. There's very few departments that can cough up a paramedic firefighter to ride in. The rider program is something we have always done. If we have a seriously critical patient, it's probably once every 2 weeks that we're sending a firefighter to the hospital. And then AMR in turn brings them back to the city of Cheney. But if they get down to the hospital and they're standing on what they call in the wall time, which could be a few hours now, where the ambulance crew is waiting on the wall to drop off a patient to the ER triage nurse, then that ties our firefighter up. So we didn't want to flood the system with BLS ambulances just to expect, firefighter, paramedics, and advanced EMTs to have to ride into ambulances. So AMR built in some assurities for us by saying, hey, if we start doing that, then we're going to pay you a liquidated damage for that to curb that behavior. Spokane Valley Fire Department last year started off with this exact same construct. I think within about 2 months, they went from, how many was it, Tim?
Actual write-ins with ALS cars, actually it dropped, the numbers dropped.
Significant.
Yeah, a significant drop. I can't tell you exactly, I'm sorry.
But it went from well over 100 times a month to about 5 times a month at Valley Fire. And they've got 18,000 emergencies, probably about 12,000 transports a year.
And one of the things that Chief talked about, which, obviously was talked about in negotiations, was keeping his units in service. And that was the idea. I need the staff. I'll have staff, and I can't afford to have my medics downtown all day long. So how does that look, and how can we accomplish that? Incorporating a BLS card, sending the right resources. And to everyone's surprise, like I said, the numbers actually fell off. They dropped significantly. So they're writing in very few times now. So we're getting the right resource to the right calls through dispatch.
So I threw this up on the slide here as just one of several examples. That glucometer cost us $32 today. When we sign a contract with AMR, they get that same glucometer for a penny, literally a penny. And they are going to cost share that with the fire departments in Spokane County. They be an AMR, GMR corporate. So we will have their purchasing power. So not only will we get a little bit of revenue in return for our disposable medical supplies, but all medical supplies, which some of our EMS supplies could be closer to $40,000 for the new Life Pack 35s that are coming out. AMR, it gets a huge cost saving just because of the sheer amount of product that they're able to purchase. So that's just one of several examples. It's something we're going to have to figure out how we synthesize that amongst the ambulance service board with all the different member agencies. But that should be a huge cost savings with ordering medical supplies. And then last but not least, there's 4 maps that breaks down the county into 4 separate zones, compliance zones. I'd like to draw your interest to the urban classification. When I started off as your chief here in Cheney almost 8 years ago, we were actually considered rural. They had 20 minutes to get to the city. These are classifications out of Department of Health and the RCW. And after I dug into the RCW, I said, no, Cheney is urban per definition under the RCW. So through negotiation, contract 3 years ago, we bumped up to suburban. And then with this contract that we're getting ready to finalize, the city of Cheney will be rightfully placed under the urban classification, which means that 90% of the time, thank you, AMR, because the RCW says 80% of the time, but 90% of the time, AMR is expected to be in the city for an emergent call within 90% of the time. So what that looks like, we're not sure. Tim and I have been doing a lot of discussing here for the city of Cheney. It may result into having to park an ambulance inside the city of Cheney, which would be a win for all of us and the citizens. We're already starting to have conversations about the next reiteration of what the future looks like. There's some departments out there, and I think AMR is trying to set up a meeting down. I don't remember where it's at in California. Sorry for Contra Costa. So a few of us may go down to Contra Costa to meet with a couple of fire departments down there that ended up into a public-private partnership And that's where you get to tap into the Ground Emergency Management Transportation Fund, the federal grant dollars. I don't really know a whole lot about that, but we're looking already at what the future is going to look like for sustainability. And that was the end of my presentation. Happy to answer any questions you may have.
Thanks, Chief. Thanks, Tim. Anybody have any questions for Chief? That was
Good
a
report.
lot of good information.
Yeah, good stuff.
Fantastic.
Thanks to you, Chief.
So a lot of education.
Where are you gonna park that car? Here, Cheney, you got any?
904 in Betsford.
Yeah.
That actually is a nice location that we're currently starting to utilize.
So as you get older, those things are important.
I agree. You know, once again, I mean, like he said, this is an education point. I've been very fortunate to be able to negotiate this contract on their side, the last contract. So when I came in and AMR offered this, my thing with AMR was, we're gonna be 100% crystal clear of why I'm here, and that's to provide good patient care. Come from that side of the fence, and how's that look? And we're in a real weird EMS healthcare. Everyone knows. I think I'm preaching to the choir when we talk about healthcare, where it's headed, and what goes on with hospitals. I know Chief Jenkins mentioned wall time and what that takes. Well, that takes more ambulances. For us to be here in 10 minutes, obviously you have to staff that. So the BLS cars are real important to the system, not the ecosystem, not just the city of Cheney, but the ecosystem, to be able to do that. And, you know, it's been really gratifying to be on both sides of the fence and to be able to come up with a product. I think it's going to be really good for your citizens. I think they've done it.
Thanks, Tim. Appreciate you being here today. Yeah, of course. Thank you, Chief. A lot of good information there. Ooh. Okay, let's move on. We don't have a public hearing, but we do have several action items. The first one, resolution F365, Parkside, second edition, final plat approval.
Yeah, they're getting ready to have everything together for the final plat. They're doing curb line sidewalks probably this week. Paving soon to follow, so that development. So approval of the final plat will allow us to gather up all the documents, the warranty bonds and everything else to move forward. I do have some corrections on the resolution. As I misstated on the conditions approval, I did put Parkside second edition instead of the streets named. And then also on number 3, Gordon Finch Homes instead of Jan Utility correction. So that end is just identifying owner of the developments. With that, I'll be happy to.
Thanks, Todd. Any questions for Todd? Go ahead, Jeff.
Just have a quick one, and I've probably missed it in the documentation. The planning commission had raised some concerns regarding like traffic and water. How were those addressed?
Well, basically our water plan addresses how many ERUs that we could have over the next 20 years, and they're well within that. And then the traffic plan was back in 2016, where we identified those lots of land and the potential density for the traffic patterns going off onto Simpson Parkway, and then also kind of filtering.
Okay. And so post-pandemic, we think those are still going to be accurate figures. And then were there any issues with like runoff or drainage for the water?
So the drainage includes basically extra area to the east, and that is all in a swale drainage area, which will be treated, and then any overflow will go into the extra, or actually the wetlands that are kind of in front, and makes its way through Safeway back behind City.
Thank you.
Any other questions for Todd? No? Good.
Todd, just real quick, there's another development. We don't need any bond, and it's all gonna be built before we.
Other than the warranty bond, which we request 20% of that warranty bond for those issues over the next couple of years.
Is it 20 years? 2 years, yes.
20 years would be great, but
Yeah.
20% for 2 years, yeah.
I know they had a lot of challenges there, so they got all that worked out and.
built on solid ground.
Anything else?
Your Honor, if there's no further questions, I'd move to approve F-365.
Second.
Thank you. I have a motion and a second to approve resolution F-365 Parkside Edition final plat approval. All in favor, say aye.
Aye.
Opposed, nay. Thank you. Resolution F-365 passes. Excuse me. Resolution F-369, the Aquatic Center Building Commissioning Contract. Todd.
Yeah, last council, this was kind of set back to have Public Works Committee review it after the information gathered. I believe it's no getting by this. This is a requirement from the building code that we have to have these things. So I'm bringing this back and hopefully we can get the commission. So with that, I'll be happy to answer it.
Thanks, Todd.
See,
Question.
Todd can't even get by without a straight face.
I know. Sometimes the codes that we live by are interesting.
Well, Your Honor, we discussed that, as we're just a victim of, I think, we're not a good fit for this commissioning thing, is we have very little, but in order to bring out a professional, I mean, you got all that overhead, but all they're gonna do is work with our contractor, make sure it's installed the way it's supposed to be, which is what we do as well as far as building inspection. And then they test it and then slap a sticker on it. And I could see it in certain things, but for us, I don't know what we're trying to accomplish, whether it's we're 14,000 in the hole if we think we're gonna save money on energy down there on the fees. But if it was for safety, okay, great. If it was for the pool itself, great. It's none of the above. It's just for the bathhouse, looking at the hot water tank. Is our HVAC, is that heating and air, or is it both, Todd? Okay, and that's just a little ductless system, and then look at the electrical outlets. But like Todd said, there's really nothing, I mean, it's the code from 2018. There should be ways that we should have some exemptions, but apparently they thought otherwise, so here we are with it.
So was that a motion?
Not yet. We did save almost $1,000 for whining for 2 weeks, so
It's worth it.
yeah, but I'm not gonna make a motion.
Your Honor,
Yes.
if there are no other presentations, I'm teasing you. If there are no other points of discussion, I would move for the passage of resolution F-369.
Second.
Thank you. I have a motion and a second to approve resolution F-369, the Aquatic Center Building Commissioning Contracts. In favor, say aye.
Aye.
Opposed, nay. Ayes have it. Resolution F-369 passes. Thanks, Todd. Excuse me. Okay, I think Cindy, you're up. Resolution F-371. This is Sterling Communications Phone Support Agreement.
Our phone system is out of life at the end of this year, so we will be doing an RFP for new hardware. New phone system, be a cloud-based system, a little more up to date. Offer some more options than we currently have, but we have a support agreement with Sterling for our current system. The reason you're seeing this, it's not over $10,000, which is typically something the mayor can just sign through his authority. However, if this goes into next year and we have to extend this whole contract could end up being over $10,000, which is why you're seeing it. So what I'm asking for is approval of resolution F-371 to keep our service through the end of the year. In the meantime, we'll run our RFP and the new RFP will have support. Well, so as long as that's operational before the end of the year, we're good to go. Otherwise, we'll be back asking to probably extend this for another quarter. But yeah.
Thanks, Cindy. That's antiquated system we have now. It works.
It works. It's just,
we
it's
need
on our
better.
servers.
Yeah.
And then when it has issues, it's our stuff that's down in our server room. And
Right. Yeah. Agreed. Any questions for Cindy on this contract? Who wants to do it?
There's nothing else. I'll go for resolution 371. That's an F.
Motion and then a second. Do I have a second?
Second.
Thank you. A motion and a second to approve resolution F-371 Sterling Communication Phone Support Agreement. All in favor, say aye.
Aye.
Opposed, nay. Ayes have it. Thank you, Cindy. Resolution F-371 passes. Todd, you're back up, I think. Yep. Resolution F-372, the Aquatic Center Geotech Engineering Change Order Number 3.
The original geotech site evaluation was done prior to even contracting out because we wanted to take a look at the site conditions. First one, we did receive 40,000. That was just an estimate. So we ran into those. That has continued over the year, which brought up the last one of Amendment 2. Amendment 3 should cover our cost as an estimate in the amount of $28,925,000. The majority of this was the earthwork site. See on the estimate on this Amendment 3 is just finishing up a lot of those special inspections that are needed. So, is there any questions? It runs about 1% of the total price of the project, and it tends to be consistent. So,
Thanks, Todd. Any questions for Todd on this change order?
Your Honor, I've come to the conclusion there are no suitable fill materials in the entire city of Cheney. I mean, it is challenging.
It really is.
That one's got peat moss, swamp, and big rock all over.
I agree.
Unfortunate they can't do commissioning work as long as they're a special inspector, but I know we have to do it, so I'll move for passage of resolution F-372. Second.
Thank you. I have a motion and a second to approve resolution F-372, the change order to the geotech engineering for the Aquatic Center. All in favor, say aye.
Aye.
Opposed, nay. Thank you, Todd. Resolution F-375 passes. Still up, resolution F-373. This is the Elm Street Preservation Project Engineering Agreement, supplemental agreement.
yeah, this is a supplemental agreement for construction engineering, and I guess I would maybe request to bring this back next meeting. There was the total is correct, but it was misleading. The original agreement was 100,000. We did go over a little bit, $26,000 in design costs when we brought in STA to help them out. That the actual amendment amount is the original agreement was 100,000. The additional design cost was 26,000, and then on top of the construction, total amount will be the same, except I wanted to make sure I break off that and give you reasons for that.
Okay, so
You
you're
saying you want to defer this?
defer this to our next meeting.
Move to
Okay.
defer, Your Honor, to the next council meeting.
Okay.
Second.
Thank you. I have a motion and a second to defer resolution F-373 until our next city council meeting. All in favor, say aye.
Aye.
Opposed, nay. Okay, Todd will defer this. Thank you. Appreciate that. Resolution F-374, still Elm Street Preservation. This is the Phase 1 Project Contract Award. Todd.
That is correct. We only, we did have a lot of people on the plan review, but only one vendor. I don't know if everybody was busy to that end that didn't, but in taking a look at the engineer's estimate, we did have a savings there. It reflects 2 bid schedules. Bid schedule 1 is the actual TI. Bid schedule 2 was quite a savings from the engineer estimate, and that is all of the STA. Bid, that was that interlocal that we last.
Gotcha. Thanks, Todd. Any questions for Todd? And again, this is not coming out of our pocketbooks right now, right? We charge this back to STA, right?
Yeah, I'm sorry. STA on bid schedule 2 is 47,600, which we will be charging that back plus any construction management under that agreement that is timed to that. And then also the TIB runs at 90% of funding. 90% of that bill.
Yeah, perfect. Thanks, Todd. Yes, please.
And just to confirm, this is from the on Elm Street 6 to Washington. Is that right?
Washington, yep. And we did get additional funding this last go around. We just weren't able to get it for design right now. And that'll be from Elm Street from North Six all the way down to Second Street.
Awesome.
Good
Thank you.
project. It's much needed project too, now, for sure. Any other questions for Todd?
Given that it was 500,000 below the engineer's cost estimate, I'll make a motion to approve F-374.
Second.
Thank you. I have a motion and a second to approve resolution F-374, the Elm Street Preservation Phase 1 Project Contract Award. All in favor, say aye.
Aye.
Opposed, nay. Thank you, Todd. Resolution F-374 passes. We do have a couple ordinances, and we are asking for all three readings, correct, Cindy? And the first one's ordinance Y-87, the 2025 Budget Amendment 1.
It's our first budget amendment of the year. I would draw your attention to the worksheets with that, just to kind of go over what these are. Grant from the fire department. They received a grant for some monitoring equipment, and so this brings the revenue in and the expense out. The police drone was replaced, and so this is the kind of the sale of that capital asset and the purchase of the new one. The playground equipment, you addressed that last council meeting, which you decided to go forward with playground equipment at the park by the aquatic center. This is the 80,000 we talked about in our mitigation funds, and the rest is going to be funded from the, as you recall, the REAP funds, but that's already budgeted, so that wasn't required on the budget amendment. The taser support agreement was budgeted in the police budget for this year, so this is where we paid that historically, is from this criminal justice fund. And the last one is the new mower in Parks and Recreation. You approved that as a discretionary item. It just did not make the final budget, so I'm adding it at this time. Happy to answer any questions.
Thank you, Cindy. Any questions for Cindy? It's normal for us throughout the year to have amendments when we need to, make sure the pots of money we have are balanced properly. So thank you for bringing this to us. Go ahead. Did you have a question, Jackie?
Go ahead. The Department of Ecology grants was that money that we got in a grant. That's that 46,000 is money we brought in.
It's the 40,000 that we'll be receiving the grant after we spend the money. So
Gotcha.
we spend the money and then we get the grant. So when we have an expense, we always have to have a revenue for that. And that's why I'm budgeting the revenue and the expense. So yes, we'll get reimbursed. They'll spend their money and then we'll get reimbursed for that.
Your Honor, if there are no more questions, I would move for the first reading of ordinance Y-87 in title and summary form only, and that the first be considered the second and the second be considered the third, and places before us for final passage.
Second.
Thank you. I have a motion and a second for the first reading of ordinance Y-87 in title and summary form only, and that the first be considered the second and the second reading be considered the third, and that it be placed before you all for final passage. Any final comments or questions for Cindy?
We did cover this in finance committee on all these items.
Okay.
Cindy did a good job.
Thanks. All in favor, say aye.
Aye.
Opposed, nay. Thank you, Cindy. Shelley, go for it.
Ordinance Y-87, an ordinance amending section 2 of ordinance Y-77, amending the budget for the City of Cheney, Washington for the fiscal year ending December 31st, 2025, and providing for the effective date hereof.
Thank you, Shelley. Councilmember Overhauser.
Aye.
Councilmember Schmidt.
Aye.
Councilmember Bartels.
Aye.
Councilmember Beelock.
Aye.
Councilmember Labar.
Aye.
Thank you, Cindy. Ordinance Y-87 passes. And ordinance Y-88, again, asking for all three, correct? Authorizing petty cash and change funds. Go ahead, Cindy.
So you as a body have to authorize us taking money and putting that into departments for use in petty cash, for the change drawers when people come in and do business. This had not been looked at for years. And I've had many departments that have actually returned their petty cash or their change because now that we have credit cards in departments, they don't need those small petty cashes as much anymore. The big difference here is the aquatic center. So when we met with Leslie and Kelly and they discussed how they want that to be up at the aquatic center, they envision more than one person taking money at times. There's going to be a couple different areas to do that. And they needed to have some change funds that we did not have authorized. So our attorney, Mike Capon, took a look, kind of updated the ordinance, got it all. So it's all good and great. And this will allow everything we currently have. And that will allow some additional change George to be up at the park. Happy to answer any questions.
Thank you, Cindy. Questions for Cindy on this ordinance? Any comments?
Your Honor, there are no questions. I would move for the first reading of ordinance Y 88 in title and summary form only, and that the first be considered the second and the second be considered the third and placed before us for final passage.
Thank you. I do have a motion and a second for the first reading of ordinance Y 88 in title and summary form only. And that the first reading be considered the second and the second be considered the third, and that it be placed before you all for final passage. Final questions for Cindy? Comments? No? All in favor, say aye.
Aye.
Opposed, nay. Shelley.
Ordinance Y 88, an ordinance of the City of Cheney establishing petty cash, change funds, impress cash accounts, and other matters properly related thereto.
Thank you, Shelley. Councilmember Overhauser.
Aye.
Councilmember Schmidt.
Aye.
Councilmember Bartels. Councilmember Bealock.
Aye.
And Councilmember Labar.
Aye.
Thank you, Cindy. Ordinance Y 88 passes. And that concludes our action items. I want to ask Todd, did you have a quick update on the pool, please?
As of now, kind of trying to get a target date of about the mid-June. Have a lot of things to do, and we have our pool contractor is kind of on schedule. There were some parts that were end up missing, so they're getting that way. So we really would like to plan for kind of that soft opening. That still is just a lot of things that need to happen. Once it's pretty much finalized, we still have inspections from boiler inspections, we have POH inspections, final building inspections to all kind.
Thanks, Todd. Chief, any of the chiefs have an update? No. Steve Marks, do you have anything to add here? Everything good, on track? Cindy, any updates? Okay, Mike, good, okay. For my report, I really don't have a report. Thank the department heads for collaborating the way you do to make things happen in the city, and I really do appreciate the hard work you guys do and your teams. So kudos to you for keeping Cheney as great as it is. So thank you. Council reports, Teresa,
Nothing, thank you.
anything, Paul?
I'm good, thanks. Yeah, nothing.
We got graduations coming up, so be mindful of the families that are visiting, show the best side of Cheney, and just slow down while you're driving through town, because there's gonna be a lot of pedestrians that are not familiar with our town.
That's true.
I don't have anything.
Good. And we'll be doing a proclamation for this to grad next council meeting. So pursuant to RCW 42.30.110F we're going to go into executive session. So I'm going to ask everybody to leave for now. And we're going into executive session to receive and evaluate complaints brought against a public officer or employee subject to RCW 42.30.144, which exempts certain discussions while collective bargaining sessions are in progress. So if you could, I'm gonna, it's gonna be 20 minutes.
20 minutes, and so we
Yes.
will return
We'll start as soon as everybody leaves.
7:09,
Uh,
7:10.
Let's do 7:10. So. Okay. Okay, we're back in open public meeting from our executive session. We don't have any other action items after this.
Move to adjourn.
Second. Second to adjourn. All in favor, say aye.
Hi.
Opposed. Thank you.